Hi, this is Ryan Brown from mockquestions.com. In this video, we'll discuss 5 situational residency interview questions from our website. We'll go over each question and some advice on how to answer them, along with an answer example. Afterwards, if you found this video helpful, please like and share. That would mean a lot to us. Okay, let's get started. Question number 1. A recent patient survey comes back and you find out that you did not meet a patient's expectations for their care. What are the next steps you would take to improve? Here's how you answer. If you were to ask any physician prior to your residency interview if they have ever received critical feedback on a patient survey, the answer would be a resounding yes. The key for you in answering this question is reiterating to your interviewers that you'd be able to take the feedback, analyze what you may have done, and use that as motivation to improve in the care that you provide to your patients moving forward. Keep in mind that as you answer, most patient feedback received is anonymous, and you may not be able to pinpoint the exact interaction that created the feedback from the patient. Here's our answer example. When faced with this situation as a resident, I certainly wouldn't let it get me down. Rather, I would see it as an opportunity to improve and get better. I would do my best in analyzing the feedback to see if I could remember which patient encounter it came from. If the feedback was more general, I would take time to reflect on why the patient may have said this about me and take all the necessary measures to improve going forward. Question number 2. If you were in a busy day of clinic and a key piece of equipment failed, how would you handle the workload, patients, and stress moving forward until a fix was found? Here's how you answer. There are some key things that you want to highlight as you answer this question to prove your ability to think on your feet, make quick decisions, and take care of what's needed in the heat of the moment. First, you want to talk about your ability to find an alternate solution and work as part of a team in doing so. Next, you want to talk about your ability to prioritize any high-needs patients that are directly impacted by this equipment failure. Last, you want to talk about your calm demeanor and ability to think critically when the chips are down and you are the resident in charge. Here's our answer example. Upon finding out that something like a scanner or the EMR went down, my first thought would be to gather the team for a quick huddle to come up with any needed workarounds for patients. If it was a piece of equipment, we could put our heads together to find an alternate piece of equipment or borrow one from another department in the meantime. If we found out that the equipment would be out of order and there were no alternatives for the day, we'd have to loop in administrative staff to likely reschedule any patients for that day that would need the use of the equipment. In the end, doing what is right for the patients would be my top priority as a resident physician on duty that day. Question number 3. As a resident, how would you handle a situation where a member of the patient care team clearly wasn't pulling their weight on the team? Here's how you answer. Your answer to this question should be direct in your approach and always consider what is best for the patient in the end. If the team member's lack of care on the job puts a patient at risk, talk about how you would both have an immediate conversation with the employee and bring it to the attention of their leader. If it was a situation where the person was having an off day, talk about how your ability to build a good rapport with your entire care team would enable you to have a professional, caring, and frank conversation with any member of your care team in this situation. Here's our answer example. Coming to your program as a first-year resident, I would pride myself on my ability to build respect and trust with all staff that I would be working with. This would include the administrative leaders, RNs, and patient care techs that I would be bedside with on a daily basis. This trust and respect would enable me to have a clear and respectful conversation with any staff member that I thought wasn't pulling their weight at any time. My conversation with them would end on a positive note by me telling them that I believe in them. If a situation would put the health of a patient at risk, I wouldn't hesitate to escalate that to the direct supervisor of the employee immediately. Question number 4. You are caring for a patient who is 3 years old and are ordering a weight-based medication. When you look at the patient's records, you find the weight was documented in pounds by the nursing staff. Explain how you proceed. Here's how you answer. To effectively answer this question, you should first indicate that you would convert the patient's weight to kilograms in order to determine the correct dosage of the medication for the child. Doing what is necessary in the moment will be a quality your interviewers will be looking for. Then, walk through how you would correct the error in a dignified way with the nursing staff, as documentation of a patient's weight is standard to be in kilograms. Here's our answer example. If the child's weight was documented in pounds and I had to administer a weight-based medication, the first thing I would do is convert the weight to kilograms by dividing the weight in pounds by 2.205. This would allow me to determine the correct dosage of medication. I wouldn't hesitate to have a conversation with the nurse that was responsible for documenting the weight in pounds. While I would be confident that it was a simple mistake, reiterating that a missed weight could have dire consequences would be important. Question number 5. You are caring for a patient on your inpatient unit who is bedridden and unconscious. When the patient came to you, they already had a bed sore. How do you prevent this from happening again? Here's how you answer. To prevent bed sores for their patients who are bedridden, physicians and residents should ensure their patients are repositioned at least once every 2 hours. Ensuring this will involve conversations with the nursing staff on the floor in a quick manner. Also, don't hesitate to talk about the importance of good nutrition and proper mattress or cushions in helping to prevent further bed sores for the patient. Here's our answer example. To prevent additional bed sores for this patient, I would ensure the patient was moved and repositioned at least every 2 hours. I would have a conversation with all nursing staff on the unit and be sure to include this in the patient's chart. If we had them available, I would look for any additional bed support like a cushion or foam pad for the bed so the nursing staff could use it. If the patient is unconscious for a long period, I would consult the physical therapy team to help prevent both bed sores and muscle atrophy. Thank you for watching. If you found this video helpful, it'd be greatly appreciated if you could subscribe to our channel. It really does help motivate us to continue creating videos. Thanks again, and we hope you stick around to watch more interview practice videos from Mock Questions.